I think the best way to describe the virtual ward is as an envelope that surrounds patients living in their own home with long-term conditions who we've identified are at risk of admission. The work is carried out largely by the community matron who actively and proactively case manages the patient, helped by the GP, other healthcare professionals including dementia and mental health, and assisted by social care if there are social care issues. And a key part of the virtual ward is involving the patients and their carers to help them understand and better manage their long-term condition to reduce the risk of an unnecessary admission.
I was admitted to hospital this week. This lady was on my caseload, came on last Thursday, and it was something that I was going to speak to social services about, putting in some sort of urgent care package support.
We're a multidisciplinary respiratory team caring for patients in the community with long-term respiratory conditions. We link in with the new concept of the virtual ward, as many of the patients that we care for have other long-term conditions and have multiple medical and social needs.
Also referred to the crisis team as well, the smart team. Yes, yes.
It is a new project, but the matrons have been very on board with it, as well as the social care team. So patients that are discussed are prioritized within the social care team, so they are seen into quickly, and assessment is being carried out in a timely fashion to prevent the risk of hospital admission.
I have actually had a conversation with Gareth Owen about, because he phoned earlier on this week. So, do you know if he's been out to us?
Today we're going to visit a lady called Doreen, who's an 87-year-old lady who I've known for the past 10 weeks, and I've been visiting her at home to try and reduce the amount of hospital admissions she's had. She scored 76% hospital admission risk, and she was also known by the respiratory nurses. And so my role is to try and visit Doreen to try and reduce the amount of hospital admissions that she has, and put some plan of action in place that she and her family can follow to ensure that these admissions are reduced. Okay, well this is your management plan, Doreen, so I just wanted to highlight to you and your carer about looking at any changes in conditions that you have with your health, so that you can alert the GP if you're not feeling very well. Particularly with you because of your chest infections you get.
Yes.
If you're more aware of your sputum changing colour.
Yes, I am.
So
yes,
yellow
I do.
or green.
Yes.
And also if you feel more breathless.
Yes, I am more breathless than I used to be.
But if your condition is that you're feeling more breathless one day when you wake up, that could be a sign that things are not as good with your chest as before.
That's right.
And that would be an indication to just let us know.
Yes.
So that we can get in early and prevent any sort of infection brewing.
Right.
Your anemia has caused a hospital admission in the past, hasn't it?
Yes, yes.
When your
2 or 3 times, isn't it?
Yeah, when your haemoglobin was very low. So now what we're going to do is we're going to work with the GP to try and ensure that we do regular full blood counts so that we can monitor it, so that we can capture it early, so that if you do need a transfusion or anything, we can do it in a planned way rather than sort of an emergency. Are you happy with that?
Yes, I'm perfectly happy, thank you. Yes,
because the community matron role is very short. It's not supposed to be sort of a long term.
But I can confide in you and I can talk to you.
I know you can, Doreen.
But there's some people you can and some people you can't, isn't there? Well, I find with Mandy I can talk to her and listen to what she's saying and taking it in, do you know what I mean?
A key part of this is us working together, and it's a very different framework to how we've worked in the past. So we've got health and social care all working together for the benefit of the patient, and I think that's the key difference between how things have worked in the past and how things work in the virtual ward.